All good? Excellent. Thank you for coming along this morning. Today I've been joined by the Chief Health Officer, Professor Sutton, Professor Sharon Lewin, the Director of the Doherty Institute, and Jerome Weimar, the COVID Response Commander. So there are currently 5 new locally acquired cases of coronavirus overnight since our last report, bringing the total number of individual cases since the start of this outbreak to 70. And that includes 1 recovered case. 3 of these, of the 5, are direct primary close contacts of existing cases. 1 case is the second child of the family of 4 linked to the North Melbourne outbreak, whose result was indeterminate yesterday, but has come through with repeat testing and has identified as a positive case. Another is a household contact of the first worker who tested positive at the Maidstone aged care centre, and that person has been isolating throughout their infectious period as a close contact of that case. The third is a previously identified primary close contact who worked with a family member who tested positive from the first West Melbourne group, that is a colleague of one of the return travellers from New South Wales. And there are further 2 cases, 2 at the moment unlinked cases from the same household, and I'll get Jerome and Brett to talk about that in a bit more detail. The focus of our efforts over the past day have been casting a wide net around particularly that West Melbourne, North Melbourne outbreak, and closely examining the incidence of casual transmission elsewhere across both the Whittlesea and Port Melbourne outbreaks. Public health teams have been working very closely investigating the potential origins of the emerging Delta variant, and the Chief Health Officer has been working closely with interstate colleagues as to seek to identify that, and we'll have more to say about that shortly. More broadly, yesterday was another big day in both testing and vaccinations, and I want to thank the hundreds of thousands of people who have come forward over the past few weeks to do the right thing about making sure that they've got tested in record numbers and give the contact tracing teams all the support they need to map and trace where this virus is moving around, and the many, many tens of thousands who have come forward, indeed hundreds of thousands, to get vaccinated as the ticket out of this pandemic. Yesterday we saw 36,362 people come forward to get tested, and we saw 24,263 people come forward to receive a vaccine from our state-run clinics. Remembering, of course, as I regularly point out, our fantastic GP network also has vaccines. Yes, they churn through them at a very fast rate in face of demand, but they continue to have the majority of supply in Victoria. And we're working very closely with the GP networks to seek to increase that amount. So my thanks do go forward to every person who has taken the steps to be tested, to be vaccinated. I want to particularly thank those private sector aged care workers and the residential disability workers who we've been working with the Commonwealth to make sure that we prioritise that group of workers who care for some of our most vulnerable community members and make sure that we help the Commonwealth lift their rates of vaccinations. Many of those workers have made the most of our 5-day vaccination blitz at state clinics, and where we've been providing them walk-up access to those clinics. I can advise that over 10,000 people in this group have been vaccinated to date during the blitz. The blitz was due to finish tomorrow, but this group are continuing to come out in such strong numbers that we will extend that blitz to include Monday for that group of workers. So can I take this opportunity to encourage all private sector, indeed all aged care workers and disability care workers to come forward, continue to come forward to make the best use of this priority access lane, remembering, of course, that you can also seek a vaccine from your GP, where you will also be prioritised. I can further announce that from Wednesday, this coming Wednesday, the 9th of June, until Sunday, the 13th of June, we will prioritise our hard-working Ambulance Victoria staff as our next blitz focus, who will receive priority walk-up status at vaccination centres right across the state. We want to get to the point where this virus isn't winning, and we want to make sure that our community works with us to keep ahead of how this arrangement can apply and how all Victorians progressively, as more stock and more supply becomes available, to do what we can to get vaccinated as soon as we can with the supply that's on hand. That is the off-ramp for this pandemic. We're on this trajectory at the moment, which we need to build vaccines for, and we are progressively doing that. And I want to thank the Commonwealth for providing some more vaccines for our state-run clinics after we sought to request that the other day. That is how we get on top of this, by following the public health orders, getting tested as soon as we have the slightest symptoms, and getting vaccinated to give us that ticket out of this pandemic. I might ask Professor Sutton, followed by Professor Lewin, to talk about a few matters, and then finally Jerome will take us through some of the further information behind the high-level figures I've provided.
Thanks, Minister, and good morning. Certainly it's been gratifying to have 3 of the 5 new cases effectively in quarantine during their entire infectious period, so minimal, if any, new exposure sites listed for them. The 2 new cases who have not been identified as primary close contacts previously do have that, again, linked to Craigieburn Shopping Centre and Epping Plaza Shopping Centre. They were frequent attendees at both of those sites. We haven't got a definitive crossover time with known cases, but they did get tested, or at least one of them was prompted to get tested because they saw that we had concerns about those settings as potentially at risk for people who pass and have casual contact with others. So it's really just not to overemphasise these sites, but to say that it does become a challenge if people aren't aware that they're a primary close contact, and so there'll be some exposure sites for these individuals because they weren't quarantining already. But it has flagged that you should look at all of the exposure sites that are listed and not just reflect on the specific times and days for those exposure sites, but if you're a frequent attendee of some of those shopping centres in particular and you don't know the exact times and dates that you might have been there, that you should think about getting tested, and certainly if you're symptomatic, to get tested. And to see over 35,000 tests today, that testing remains extremely strong. That's probably half of all symptomatic Melburnians on any one day. So having that number tested every single day really does help us identify any potential coronavirus cases that are out there. That's a really strong performance. The only other thing I'd like to talk about today, I do understand there might be some anti-vax protests planned for today. It's hugely unfortunate that there's that sentiment in anyone. I think they represent a really small minority. And I should say the vaccine is not mandated. So as an individual, you're free not to get it if you don't want to get it for yourself. I still find, some discomfort with that because we're all going to be protected with high vaccination coverage. But it is your choice. But do not get in the way of all of those Victorians who are trying to come and get vaccinated today and every day. Record numbers again for Victoria. And those are Victorians who understand that it's protecting yourself. It's certainly helping to protect your immediate family. those who can get vaccinated in addition will be protected, but those who are too young to be vaccinated or those who are otherwise unable to be vaccinated right now, they will also have the relative protection of you getting the vaccine. And Victorians understand that. And then there's the broader vaccination coverage that will just help us get to that safety zone that we are desperately looking for in Victoria, in Australia, of very high vaccination coverage for everyone, that just suppresses the virus ongoing. It is a race because we need to get to that safety zone as fast as we possibly can. The greater numbers that come through every day, the faster that we will get there, obviously. So all I would say is please let those who are motivated with a very positive intent to get vaccinated do so freely and safely. Thank you. I'll let Professor Lewin speak just about some of the variants and the work of the Doherty Institute in relation to the sequencing done for that.
Thanks, Brett. So I'm going to speak to you a bit about genomics, how it's done in Victoria, how we align the sequences across Australia, and then a bit of information about the variants. So every positive case of COVID in Victoria is sent to the microbiology diagnostic unit at the Doherty Institute for genomic sequencing. It's work done under the leadership of Professor Ben Howden. At the moment, we're, of course, sequencing all of the locally acquired cases that are occurring right here in Victoria. We've done 73% of those cases, and in the next 24 hours, we expect we'll have 87% of cases sequenced. On average, it will take about 24 hours to get the sequence back. We also, of course, do exactly the same process for any person in hotel quarantine. Now, overall, we can identify the sequence in about 80% of positive cases. So why can't we get the sequence from 100% of cases? Well, for 20% of people in hotel quarantine, they've either got their virus levels are too low in order for us to get the genetic sequence, or they're at a phase of their illness which is only fragments of virus there, or the genome sequencing just doesn't work. It will happen on a small percentage of people. And once we have those sequences, they are put up into a national publicly accessible database called AusTracker, and as well as an international database called GISAID. And the same process happens around the country. So when we have something like the Delta cluster identified here in Victoria, we now look for a match. Is there a match between the Delta strain we've seen here in Victoria and our national network? And nationally, there is constant discussion amongst these experts through something called the Communicable Disease Genomic Network of Australia to make sure that every single sequence is interrogated for a match. At the moment, we don't have a match. So the 20% chance that we don't have a match. So therefore, how could have a transmission had happened? It could well be from a person that was positive in quarantine in whom we don't have that genetic sequence. Every effort is being made right now to look for that match, but we may not get the match. On a second aspect of these variants, I thought I'd just update you on work coming out of Public Health England. So Public Health England have a superb network of genomic sequencing. At the moment, about 60% of their positive cases are sequenced, and they track many aspects of what's happening with that very rich genomic information. So the first thing is around infectiousness, and they're comparing. So at the moment in Victoria we have two strains, the Kappa strain, which is the main strain in our outbreak, and this recent small cluster, the Delta strain. And they, in the UK, compare a range of factors to the Alpha strain, the original UK variant. So first of all, what does the infectiousness look like? Well, I think from the UK data we're getting very clear evidence that both the Kappa and Delta strains are about 50% more infectious. That's based on something called the attack rate. The attack rate is the number of positives over the numbers of people exposed, which is 8% for Delta, 11% for Kappa, and 12%. 8% for Alpha, the UK variant, 11% for Kappa, and 12% for Delta, so about 50% more infectious. Does that mean that the usual measures that we use to stop transmission don't work? Absolutely not. They all work. So masks, physical distancing, hand washing, hand hygiene, they all work. So we can use exactly the same public health measures to stop transmission. What about the effect on disease? Well, again, this is new data that has come from the UK. I should say that the data on, there's a lot more data on Delta, the small cluster we have here, rather than Kappa, because Delta is the dominant variant. And the report is that there is increased hospitalisation, about 2.6-fold increased hospitalisation in people with Delta compared to the UK strain or Alpha. And these are based on quite small numbers, so there may well be errors. However, reassuringly, that of those cases that are hospitalised, 73% of them are unvaccinated, because we know that vaccination does help protect against infection with both of these variants, Kappa and Delta, and likely significantly prevent hospitalisation. The last area that most people are interested in is about the vaccine protection. We think it's slightly reduced with Delta, Kappa, but probably quite similar to what we know with Alpha. And I shall stop there and hand over to Jerome. Thank you.
Great, thanks Sharon, and good morning. I'll just do a brief update on the rest of the outbreak and then we'll be pleased to take any questions. So as the Minister said, 36,000 or so test results yesterday. That now means we have over 500,000 test results returned since the start of this outbreak, a truly phenomenal response by the whole community to collectively getting on top of this outbreak and getting us back into our COVID-free status. Over 24,000 vaccinations. Now 1.35 million doses of vaccine are deployed here in Victoria by both the GPs and the state clinics. And my thanks to all those people working in our vaccination clinics and in our GP surgeries in driving this really rapid vaccination program. We continue to open our vaccination clinics today and tomorrow over the weekend. Please, if you are part of the half of all adult Victorians who are eligible to get vaccinated, if you haven't yet been, then please come forward to get vaccinated and make it part of your plan over the coming days. We have 69 active cases of coronavirus in the community today. 3 people still in hospital, but none in ICU, and we of course wish them all the best with their recovery, as we do with everybody else who is currently dealing with COVID. We have 5 new cases today. And as the Minister has said, 3 of those are with existing primary close contacts and 2 are new community cases. In terms of the City of Whittlesea outbreak that we've been discussing over the last 10 days, there's no new cases for that outbreak, still 29 active cases at this point in time. The Port Melbourne outbreak, 25 positive cases at this point in time, no change in the number of cases there. The the aged care cluster, is now 6 active cases. That's an increase of 1. One additional family member of the first positive case is now active. Again, a primary close contact. There's no further exposure sites for them. And then, of course, our new cluster, the Delta variant cluster that we're most concerned about, now 9 active cases. That's an increase of 2 from yesterday. One of those is a second child of the second family. So we have 2 families of 4, both active with COVID. And then 1 further primary close contact, a workplace colleague of the first case that we identified a few days ago, and we have identified some exposure sites for that individual. In terms of the North Melbourne Primary School that we discussed yesterday, now 339 primary close contacts, 82% of them have now returned a negative test result. There are about an additional 100 primary close contacts in the wider West Melbourne cluster at this point in time. To turn briefly to the 2 new positive cases in the community, so these were new cases we've identified in the last 24 hours. The first was an individual with a number of exposures, particularly at Craigieburn Shopping Centre, and that I'm so pleased and we're so grateful that this individual came forward on the back of the really active intensive work around that location. We have not yet formally connected that individual to the wider City of Whittlesea outbreak. That work and the investigation is ongoing. In addition, their partner who is an employee at one of the larger construction sites here in the city. It does mean we have 170 further workplace contacts for the partner who are now locked down. My thanks to the construction site concerned. The construction industry has worked incredibly hard over the last year or more to put in place really strong workplace controls, workplace recording systems, and they are now, of course, since last night, going through that process of contact tracing with us and to make sure we lock all those staffs down. That site is now closed, and we'll continue to work with them over the coming days to ensure we get those workplaces tested. Those two cases for us are a real priority for us over the next few days to establish any other downstream infections that may have occurred. I am pleased to say, as we are getting now through into our day 13 testing for the older parts of the outbreak, the more stable parts of the outbreak, we cleared 600 primary close contacts yesterday, so 600 primary close contacts who have been doing the hard yards of isolating for 14 days. They returned their day 13 negative tests and they were formally released last night. We have around another 800 or so primary close contacts that we're working with today, again to return their day 13 negative tests, and once those negative tests are confirmed, they will also be released. And we will continue that process over the coming days. We're also expecting to release around 150 exposure sites over the next couple of days as we work our way through the older parts of this outbreak. And can I just say a huge thanks to all those people who are continue to be primary close contacts and those who've put the hard work in over the last 2 weeks. I know it's a very difficult thing that we ask of you. It is so important. We continue to conduct over 800 home visits every day to do welfare checks and to make sure we have people fully supported. And again, the vast majority of people are doing the right thing, which is such an important part of getting hold and control of this outbreak. In terms of forward actions, both Professors Sutton and Lewin have talked about, obviously, our ongoing work with the West Melbourne cluster. That is a priority for us over the next few days. We have continuing focus on our testing sites, particularly around Craigieburn Central and Epping Plaza. We've seen a number of recent positive cases moving through those locations. There are now 9 testing sites around both of those, or around those 2 locations, at Epping Plaza and at Craigieburn Central, plus a further 4 pop-ups. So if you are a frequent user of those shopping centres, please check the exposure sites list that we have. If you have any symptoms, no matter how slight, please come and get tested. Again, I go back to the really high testing numbers we've seen over the last 2 weeks. That is about us collectively getting hold of this outbreak and running it to ground. We would really like to make sure that over the next few days, we use these precious days well to establish whether there's any other change of transmission out there around these particular clusters. Finally, of course, we will be open all weekend with our testing sites, with our vaccination centres. We will run extended hours. My thanks to all the staff who are working in those locations and everybody who's been involved in working on this outbreak. It is going to be a busy few days, and we'll make sure we're there with you every step of the way. With that, the Minister, Professor Lewin, Sutton and I are happy to take any questions.
I'd love to ask one to you, Jerome.
Sure.
Do you have any hypothesis for how today's unlinked case, who picked up the virus at Craigieburn Shopping Centre,
Yep.
you suspect, contracted the virus?
Yeah, so we have a number of leads. So this individual is a daily visitor to Craigieburn Shopping Centre. We have now a total of 7 positive cases on a number of different days who have been in and out of Craigieburn Shopping Centre and individual stores within there. That is the leading line of our investigation at the moment. We're working closely, obviously, to get his exact movements and exact overlaps with other positive cases, but that's the lead hypothesis at this point in time. We'll obviously confirm that over the next day or 2 as we lock that down.
And do you have any plans for a QR code crackdown of that shopping centre, given that it's shaping up to be quite a concerning exposure site? Yeah,
look, and absolutely. So we've obviously tightened our QR code arrangements a few days ago, and we will continue to do that. We've been stepping up retail and QR code compliance really since the beginning of May. That work will continue. We have a significant number of our authorised officers out and about, along with other colleagues, to make sure that the stores and retail units are aware of the new requirements and the stringent requirements around QR codes, and that work will continue, both of those exposure site locations and more generally across both regional Victoria and Metro Melbourne.
Jerome, can you just take us through just those 2 new cases again, so we've got it absolutely clear?
Sure.
So case 1 and case 2, where you presume they picked it up from?
Yep. So case 1. Case 1 of the new cases, the unlinked cases we're announcing today, is somebody who lives up in the north of our city, who lives near the Craigieburn area, has had daily exposure to the Craigieburn shopping centre and a number of the exposure sites that we've previously listed. This individual came forward to get tested on the back of some of the really good work that the local shopping centre management and our local teams have done in the area, alerting to the fact that we are concerned about people with symptoms. He came forward to get tested, returned a test result yesterday, and that was positive. We immediately rapid tested his partner. His partner is an employee at a large construction site here in the city. That site was locked down last night. We're obviously working with both the employer and the construction firms to get all of those staff tested, and we'll do that over the next day or so.
Can you tell us where is that? Yeah.
What is the site?
It is a private site. It's a pro-build site. I don't have the exact detail here, but it is as all construction sites are, it is a closed site. The operator and the construction firm there have been very, very collaborative and will continue to be, and we'll make sure we...
What do we tell us where it is? I mean, the whole point is that we know who's been there. I know they've got
Sure.
good records, but can we get more information on exactly where that is?
So I'll happy to give you that later on today, but it's as I said, it's a pro-build site. One of the strengths of the construction industry, and one of the requirements that they've had over the last year or so, is to have really strong records on site about who's coming in and out of those sites. Again, the construction industry has been really industry leading in terms of some of their own procedures they've taken on board. So this will be an important test for us and for them as to how that.
So, well,
sites
Yeah.
obviously date back quite a bit into the late May period.
Yeah.
These two people who are tested positive today, their infectious periods would have potentially begun prior to the outbreak, prior to the lockdown. Do they have any exposure sites listed other than the construction site? What were their movements in the period where they were not quarantining?
Yeah, so we're still working with those individuals on the exact movements that they have. Again, exposure sites for them will be updated as we go along.
Sorry, you go. Keep going.
That's it.
So the Delta cases, I just wanted to ask about exposure sites that were listed yesterday.
Yeah.
So they're exposure sites in Brunswick, Melbourne, the OPSM store, another World China store in Melbourne, a Mickleham store, the 55 Collins Street building in Docklands.
Yep.
Are they all linked to the second Delta family and their movements before the lockdown began?
So a combination. So the exposure sites we've listed in the last 24 hours, as you say, associated with the Delta outbreak or the West Melbourne outbreak, are both associated with the first family, the second family, and the new primary close contact, the new workplace contact that's gone active.
How much time do you expect it to take, now that we've got all these newer exposure sites that actually where people were exposed before the lockdown began? How long do you think it will take to get to all the primary close contacts there, get them to test? Do you expect this to take the duration of the week now that we've got these brand new exposure sites?
I think what we typically see with exposure sites, and the narrative we've had over the last couple of weeks, is that when we list an exposure site, we usually get a very strong return in the first 24, 36 hours of people who've been identified at those exposure sites who come forward to get tested. And that is a combination of, if we have QR code systems, records, we obviously use those. Again, we've got some employer sites. Again, we use their records, visitor books, etc. But of course, through discussions like this and through our websites and the media websites, we see people coming forward. So usually we see 24, 48 hours, a good response in terms of people coming forward. The test results are now coming well within 24 hours. And for primary close contacts, people we're particularly concerned about, we get them even faster. So
we talked about last week draining the swamp of these primary close contacts. With this new Delta variant and the new exposure sites linked to it, is the swamp just getting bigger as the days go on? Are you needling in? Do you have a good ring around the Delta outbreak now?
Look, I think we have a ring establishing around the Delta outbreak. We've got, 440-odd primary close contacts identified at this point in time. The next few days will be critical because we'll see where this one goes. We've now found one workplace primary close contact and one primary close contact going active via the school community. It is going to be really important to see over the next couple of days what are the seeding out we see from this particular outbreak.
Can we ask Professor Sutton, if we can, please? Obviously, it's still a mystery as to where this Delta variant has come from. And from what Professor Lewin tells us, we may never know. So what does that then mean for us coming out of lockdown? Would you be comfortable coming out of lockdown if we don't know where this has come from?
We have to have all those other assurances of high testing rates across the Melbourne community in particular, but across Victoria, so that if there are those upstream cases, the cases that might be the beginning of this Delta variant in Melbourne are found if they're out there. That's one thing that we have to be sure of as well. But if we only have those downstream cases and nothing else emerges, I'm confident that those pillars of public health response, the contact tracing and the rings of control that we put in place, can manage this as it can for any variant. It is a challenge, the transmissibility, the secondary attack rate being 50% greater than the alpha variant, does mean that you can get a large number of people within a home testing positive, and you can get those transmissions in other settings more readily. But we can still manage all of that. But I am absolutely focused on making sure that if there are any other upstream cases out there that might be the beginning of this seeding into Melbourne, that we find them.
I suppose what I'm asking is is it going to delay us coming out of lockdown not knowing where this is? If it's still a mystery, is it more likely to delay it?
No, not that in and of itself. We just need to know every case that might be out there. If the upstream cases have come to an end for whatever reason, because we began the mask wearing, we began the limitations in household visitor numbers, and that this is the only remaining chain of transmission, then I think that's manageable, and it doesn't impact on our decisions later in the week. But we have to be really clear that we need to find any cases that are out there.
How concerning is this Craigieburn one for you, considering they didn't come in contact with anyone? Do you think it's likely there are more cases that we don't know about because of that, or is it unlikely to be transmission like from touch points?
I don't think it's necessarily surface transmission, but I do think that it's the potential for people who pass each other within the corridors of that shopping complex. So. Great that we're flagging it, great that people are responding and getting tested because they see that exposure site, but we can run this down as for every other case. But it is a lesson that you should have awareness of all of those settings, all of the exposure sites that are listed as current, because if you're attending there regularly or if you've been there at a time that's listed, it's really important to get tested.
Does it give you comfort, Professor, this might be one for the other professor, but does it give you comfort that there hasn't been any hospitalisations with the Delta case? If it had been spreading for a number of weeks or months, it probably would have shown up in hospital, right?
Yeah, certainly it's not been spreading for months. If it's been spreading for days or weeks. The way that it expands in terms of the attack rate would mean that we would have seen, people with more severe illness, and they would have presented to hospital, been tested in emergency or required admission to hospital. So I think we're at a relatively early stage of it being introduced into Melbourne. That said, we need to find each and every case, because that's the only way that you can bring these chains of transmission to a proper end.
Is there a possibility that the fellow who had it in New South Wales, the Barbecues Galore guy in mid-April, that it's actually been spreading around New South Wales since then, and that the virus is actually in some way mutated slightly, and that's why the genomics aren't able to...
No, I mean, Professor Loon can speak to that, but it is not a close match that would make you jump to that linkage at all.
Just absolutely ruled out that it's linked to that man. Yeah.
You want to speak to that?
Yeah, there's no match. So you can really closely align the barcode essentially of these cases and see whether they're one or two matches different or further, and it's not matched currently.
So does that mean that the trip to Jervis Bay by one of the families is not connected to the possibility?
I'm not sure I answered.
Well, one of the families with the Delta variant in Melbourne had been to Jervis Bay, and there was originally a suggestion maybe that's where they caught it. So would you be confident now that's not the case? And certainly I think the New South Wales Health Minister said last night he thought that had been ruled out.
The only thing that could rule that out is extensive testing in the Jervis Bay area and no further cases. So that's happening right now. So
do you have a hypothesis that you're working on? Do you have a suspicion about how the Delta variant might have made its way to Melbourne?
My strong hypothesis is that it's come in through a importation from overseas through our quarantine hotel system. That would be the most likely. And we sequence every single positive detected in the hotel quarantine system, but we can only successfully get genomic information from 70 to 80%. That happens around the country. And so there's 20% of people who are positive who we do not have a genetic barcode for. So that's my strongest hypothesis, I think.
Professor, does that a leak of that particular genomic strain from hotel quarantine rather than a possibility of it having mutated in Australia?
it would be most unlikely to have mutated in Australia. So these two variants, Kappa and Delta, are related because they're both originally described in India, but they're very different. So we have virtually no transmission here. We have tiny, tiny numbers, so it would not have mutated in Australia. Would have been a separate importation. Cannot say if it was a quarantine leak, and we cannot say where that might have happened.
Does that mean, despite all this happening at the same time, it's just super unlucky that we've got these two separate leaks as they are?
I think that, in a way, it's super lucky that we're doing a lot of testing and found it. But I don't see that there's no evidence at the moment that the current Kappa outbreak in Melbourne is linked to this small cluster of Delta infections.
Sorry, Professor, do you test diplomats and other people who get exemptions from hotel quarantine if they're positive in their home quarantine?
Should I maybe get Brett to answer that? Or?
I mean, the management of diplomats is a Commonwealth issue, so it's probably best directed to the Commonwealth. But we, to the extent that we can enforce it, recommend testing as we would for anyone early in their quarantine phase and right at the end of their quarantine phase before they're released from quarantine.
Yeah, Canberra's very close to Jarvis Bay. Do you think there's a potential that that's one of the possibilities?
I don't want to speculate on another jurisdiction, versus Victoria. We have to look at every single possibility because we have to run it down wherever it might be in Australia. So it really is a case of leaving no stone unturned and not jumping to assumptions wherever it might be.
Was there any thought to perhaps shutting down the Craigieburn shopping centre for a while to try and get on top of it, or does it not?
Look, it's come to my mind, but I immediately think people need to shop. These are food stores, and they would go elsewhere. It's actually a good opportunity to engage the community there who regularly attend that site, and to make the most of provision of information through that site and get testing stepping up there as well.
Do you know how many people have been given an exemption from hotel quarantine in Victoria during the period of when the person might have been incubating the virus, say 2 weeks? Or?
I think Jerome might have some data on that.
So, look, there are. I don't have the numbers to hand. We can give you those details later. There is an exemptions process. The way the exemption process operates, as Brett has said, some of those are handled by the Commonwealth in terms of diplomats. We have obviously some exemption arrangements for international transfers. We have some exemption arrangements in place for maritime crews who are coming in very briefly and then heading out again by flight. So we can provide those details separately. But it's a very small and tightly controlled group of people. And I think, as Professor Lewin has said, we aim to test everybody who comes into that exemptions process.
Professor Lewin, can I ask you again, as an area in this, as a specialist in this particular area, would you be comfortable if Victoria was to come out of lockdown or open up a bit without us knowing where it came from? As an expert in your field, in a perfect world scenario.
I think Professor Sutton answered that, and I fully agree with his answer. Yeah.
Also, is there any evidence that the Delta variant of COVID is passing more easily in children? I'll go with that one first.
No, I really can't. There's some anecdotal reports out there, but I don't have any real evidence. The best data on this comes from the UK, where they update all information on variants every week. The most recent one was on the 3rd of June, and there's no data in there about children transmission.
Can I ask about the AusTracker database? So that's genomic sequencing from across the country that goes on there. How quickly does it get updated? Is it every day it gets refreshed and we double check our genomics with it?
There is variable speed at which data is uploaded to AusTracker around the country, and that's because some states upload their data first to the international database, GSAID, and then data from the international database goes to AusTracker. There are different criteria for how complete that genetic sequence is, of whether it goes to AusTracker or not. In AusTracker, the goal is to get every sequence, even if not complete. So there's a big effort around the country now to make sure that even incomplete sequences are uploaded to AusTracker. But most jurisdictions, certainly in Victoria, uploaded immediately into both AUSTRACR and GSAID, but there are different criteria for what those two sites will accept.
Are you concerned that there are holes in the database from different jurisdictions around Australia?
Yeah, my understanding is that the network of experts that do the genomic testing around the country, who all communicate through a network called Communicable Diseases Genomic Network Australia, met yesterday and are confident there are no gaps. All sequences are being or have been uploaded to AUSTRACR, including the incomplete sequences, and there so far is no match with what is available in AUSTRACR.
And in regards to the Kappa cluster of cases, can the Doherty Institute 100% say that that originated out of South Australian quarantine?
There was a clear match with the genomic sequence that was in the South Australia quarantine in the hotel where the original patient was that came to Melbourne came from. Yeah, so it's a clear match with that.
Sharon, given that we've got such high testing rates here, is there the possibility, and I don't want to point the finger, but is there the possibility that the virus could be circulating in other states undetected?
I think that is actually really unlikely because eventually we were talking about I think it's really unlikely it can go for too long. It's a good point to remind people that hospitalisation is not common, of course, with COVID. Most people do not require hospitalisation, but about 20% of people will get severe symptoms, and of those, some will require hospitalisation. And if it's in an older community, you're more likely to have hospitalisation. I think it'd be really unlikely that it could be circulating for an extended period of time without detecting it in hospitals.
You said that your strongest hypothesis was that the Delta variant leaked out of hotel quarantine, our hotel quarantine system?
Couldn't say. Yeah.
Has there been any, this could be one for Jerome, but in investigations between yesterday and now, has there been any new line of inquiry as to the Delta family's links to any high-risk sector or the hotel quarantine system?
So obviously we're doing a lot of work at the moment to establish connections to the families involved in this Delta outbreak. There are no connections to sensitive settings from those families directly, and there are no connections at this point to any sensitive occupations or sensitive sectors. We do have a very small number of people, less than 5, who are resident in public housing, who are primary close contacts via the school, and of course they're being fully supported at this point in time. But that's the only peripheral connection we have at this point.
Jerome, how are you feeling at this point? Last Saturday, we were on the heels of this.
Yep.
Are we keeping up?
Yeah, look, I think if you look at the Kappa part of the outbreak in terms of the City of Whittlesea work, the Port Melbourne work, even the aged care cohort, I think we are starting to see that we've got stability in those particular outbreaks. I'm a little bit concerned, like Brett, around the 2 new positive cases today associated with Craigieburn, but I'm very, very confident that we'll continue to really drag those to ground very, very quickly. We are really keen to see people continue to come forward and get tested, particularly at those exposure sites that we've been stressing over the last few days, particularly those exposure sites around Craigieburn Central and Epping Plaza. We've got additional teams out there today. We've got 4 pop-up testing sites around those locations. It's a really important opportunity for us to identify anybody else who might be symptomatic in those areas, and just to make sure we use these precious days that we have. And look, we absolutely recognise that by extending the lockdown in Melbourne, those are really costly days. It's a price our entire Melbourne community is paying for these few days, to allow us to be absolutely confident we've got all the information we need for Brett and others to make a really tough call in the coming days ahead.
You mentioned about 5 people in public housing towers who are
Under 5,
identified
yeah.
as close contacts. Given what happened last year, are you concerned about how are you ensuring that these people are isolating carefully?
Sure. So we have a whole group of support happening at the moment around particular public housing residents. So there are dedicated testing and community support teams that are working in those locations. We're providing a lot of support to the very small number, fewer than 5 individuals who are primary close contacts, to make sure they've got everything they need. We're also seeing a lot of dedicated and very sensitive vaccination efforts taking place around the public housing estates to make sure that we give people really good access to vaccination. It's a So really good, end-to-end package of support, and we'll continue to do that over the days, weeks, and months ahead.
So they tested negative so far? Sorry, how many?
Yes, they've all tested negative.
They've all tested negative.
Yeah.
So the building site, that has to close.
Yeah.
170 workers, you say,
That's right.
obviously have to be tested.
Yeah.
Are they considered tier 1, and will they have to isolate for?
Yes, so the workers are regarded as primary close contacts of the new positive case, the second positive case today. So the 170 workers will be primary close contacts at this stage. They'll need to be tested today. They'll need to return a negative result. They'll need to isolate for 14 days, regardless from point of exposure. Look, it may be as we go through our ongoing investigations, we work out exactly where this individual was within the site, who they had contact with. We may reduce that number, but at this point in time, it'll be the full 170.
And is that the first time it's happened at a building site in the city?
I think we've had them before last year. Certainly it's the first time we've seen this kind of exposure site in this particular year. But again, we've had a long experience of working with the construction industry. They've got really robust, not only recording systems for who's at work, is at what times people are coming on shift, where they're working in the work zones, those virtual work bubbles. So that will all be part of our investigation with them over the next few days.
How much does a site like that concern you, though? Because those people are clearly moving around the community, not in lockdown.
This is the thing. So when we find a new positive case, whether it's the first case, who's related to Craigieburn Central, or their partner who's associated with the construction site, it all comes down to how active are they in the community, and that's one of the reasons why we're in the position we're in today. We wanted to reduce the amount of movement around the community as we bring this fast-growing, dynamic outbreak to ground.
I just had a few questions on vaccines. So, firstly, did the feds give any commitment to increase AstraZeneca supply to GPs, or the doubling that James Merlino wanted before National Cabinet?
So we've had very constructive conversations with the Commonwealth, both at a department and ministerial level, and I think the Federal Minister committed to increasing supplies, and I'm reliably informed that the first of those was due to arrive yesterday. I'll have to check. In fact, they did. I've not heard they haven't. And as part of that, we've backed the AMA's call in seeking to double particularly the AstraZeneca allocations and to bring on Pfizer for the GP network, because that to us looks like the big area that can take a lot more capacity really quickly. GPs are burning through, in some cases, in half a day, their allocations. And we strongly support their call through the AMA for the doubling of allocations to the GP networks. In terms of our figures, we were bumping along at 140,000 a week. The rate we're going now, we're at 170,000 a week. We could do more, and I'm pleased that the Commonwealth, at least for the immediate period ahead, have provided more vaccines for us to lift our rate a little bit more.
When we ask them about there being a shortage in Victoria, they give us stats that they claim dispute your view that there's a shortage. They tell us that there was 102,000 AstraZeneca delivered yesterday, 171,000 Pfizer, and that there are stockpiles in Victoria of 160,000 of both. You seem to be on different kind of planets on this topic.
I don't think so. I don't accept that. What we're now clocking over into both the second AstraZeneca doses, and which is a 12-week gap, and we're also, because we've now started Pfizer a week or so ago, that's a 3-week gap. So we want to make sure that we've got adequate supplies of those vaccines on hand here in Victoria when we need them. The Commonwealth are cooperating, and we thank them for it. They would be the first to admit that the supply of vaccines through the global supply chain has been bumpy, and we want to make sure that when Victorians have their second vaccine due, that we've got the vaccine here in Victoria. So we want to make sure that we iron out that bumpiness to the greatest extent we can, and we thank the Commonwealth for that, but we also want to lift the rate, and we think our GP network is ideally placed to do that, And we've also called for allocations for our pharmacy network, particularly in those areas where there's a GP gap, and that's particularly the case in some of the regional and rural areas and a couple of the outer suburban areas. And we're working with the pharmacy organisations and the Commonwealth to identify how that works. So I just dispute that that we're on some different alignment with the Commonwealth. Their figures as to what's showing up when, and our figures showing what's arrived when, they're capable of being resolved. And I've seen nothing but an increase, and I'd welcome that.
Just one more on vaccines. The Prime Minister yesterday floated this idea of essentially a vaccine certificate linked to your Medicare account that could be used in a situation of border closures down the track. Do you see that being the case? Could a vaccine, a vaccination for someone mean they could go into an interstate setting if there's an outbreak?
Look, I'd have to get advice as to specifically what's proposed, but all of that presupposes, I think, a degree of vaccination levels that give public health experts confidence that those kind of arrangements can apply. And at the moment, I'm pretty sure, I think Victoria's 18% of at least initial vaccines, and fully vaccinated, it's between 2 and 3%. Either of those figures are nowhere near enough to give public health officials the confidence, from what I've been briefed, as to an unrestricted or a version of an unrestricted process of certainty for crossing in the cases of lockdowns or shutdowns or those kind of things. Having said all that, let's see what the experts advise us.
Minister, also at National Cabinet yesterday, capital city Lord Mayors are pushing campaigns to get people back in their CBDs, and part of that, they want to rethink of density limits and square metre rules. Now, obviously, it's premature in Melbourne, but as a general principle, when hopefully all of this is over, are you willing to cooperate with the Lord Mayors to ensure that? Do you think that's a good idea?
Yes, we're all for any constructive engagement with local government, particularly the CBDs, who have seen a huge change in how they operate over the last 18 months, in lockdown or not in lockdown. Patterns of work, patterns of visitations have really changed. And as we've seen in Victoria, we've progressively changed those density quotients based on health advice, all with a view to keep people safe, but to, when we can, support businesses. And I'm sure we'd be up for any constructive conversations with the Lord Mayors about those ideas.
Minister, in terms of stopping the spread to regional Victoria, have you had any reports about how successful the roving police patrols have been and any cases of people breaching rules?
I've had updates that Victoria Police are out there 24/7 on both major arterial roads and side roads, that there's been spot blitzes, that they're using licence recognition technology, and in regional Victoria, really good support from local businesses and local police about making sure that if you are a Melburnian in regional Victoria with a legitimate reason, that you bring your restrictions with you. So far, I've only had good reports. If there are updates, I'm sure we'll provide them to you.
Do you think roving patrols will be enough heading towards the long weekend, though?
Do I?
Do you think roving patrols will be enough heading towards the long weekend?
We take police operational advice on these matters, and their operational advice is that throwing all of their resources into highly mobile 24/7 arrangements is the best way to go, and we've only seen evidence that that's to be the case.
Looking ahead,
Jerome, sorry, one more. I promise this will be the last one. Jerome, just with the 5 cases, primary close contacts in the public housing system. Sorry, were they linked to we call it the West Melbourne cluster,
Yep.
And that's the Delta variant.
That's right, so fewer than 5, I said.
Sorry?
Less than 5,
Less than 5.
but
Okay.
they are associated with the West Melbourne cluster. Yeah.
and sorry, Minister, I wanted to ask you one. It's like a jack-in-the-box. My apologies.
Good exercise.
Minister, in a practical sense, when does a decision have to be made on coming out of the lockdown? What day do you have to, from a political and practical sense, do you have to say, okay, this is the day we must make a decision one way or the other?
There's no simple answer to that question, Nick. Clearly, as we approach next Thursday, the kind of facts that we've been going through here, the evidence, what cases where, are they linked, are they unlinked, have we got the support around them, have we got the sort of evidence that Professor Lewin was talking about as to knowing where they've come from, have we seen any upstream outbreaks, have we closed off the downstream circuits. These all go into the mix, and rest assured, the people of Victoria, that we don't want to keep this system in place for a moment longer than the public health advice says that we need it in place, and we'll have more to say about that in coming days.
But you made the announcement, didn't you, on Wednesday?
We did.
Last week to extend. So would it be fair to say that either way you would hope that you'd be able to make some sort of announcement on the Wednesday, give people 24 hours or so?
Look, I couldn't possibly say more than what I have, because it will all depend on the epidemiological circumstances at the time, informed by the range of factors that we've been talking about today.
Sorry, I just want to very quickly go back to my previous questions. Sorry everyone else as well. The AMA position that you support, did the acting Premier actually take that position to National Cabinet, and was it supported?
Well, I wasn't at National Cabinet, but I certainly raised that directly with my colleagues, and I know at the political level, and I know that at a departmental level before National Cabinet that was specifically requested following my conversations with Commonwealth officials and ministers. So between my conversation and National Cabinet, a detailed request for extra Pfizer and AstraZeneca for state clinics, extra support for GPs, and initial support for pharmacies was requested of the Commonwealth. And I was very pleased that that was received in a positive sense, and that we got, as you've indicated, some initial extra allocations yesterday, and we're hopeful that there'll be more.
And putting aside Morrison's vaccine passport idea yesterday, just at a principle level, if you've had 2 vaccines down the track later this year, when there are hopefully many more people who've had 2 shots, will that override a border closure? Should people who are fully vaccinated be able to travel interstate?
It's too early to say. We'll take the public health advice, but clearly we can't keep chugging along at low rates of vaccinations and expect things to change. The goal to that kind of conversation being successful is high rates of vaccinations, and we are still some way away from that. The sooner we get to the highest level of vaccinations we possibly can, is the sooner we have all of those kind of conversations about freer and greater movement, greater economic return, returning international visitors, Australians being allowed to visit internationally. All of these pathways out of this pandemic are predicated on higher levels of vaccination. And at the moment, I think it's between 2 and 3% of us are fully vaccinated.
And just for clarity, you said less than 5 close contacts of the public housing tower. Can you give us a number?
Somewhere between 0 and 5. We don't want to identify families, so we want to make sure that we work cooperatively. Particularly, I've got to give a shout out to the fantastic work being done by the community health partners, Mary Health, Co-Health, Star Health. A whole coalition of groups have been working for months, building up really close relationships with those public housing communities and other high-risk housing groups, both in terms of training up people as community leaders, dealing with some of the misconceptions around vaccines. And I know Mary Health and DPV Health, for instance, in the Coburg and Brunswick area in recent times, have been getting 75% of some of those towers in their communities vaccinated. And I think that's an extraordinary result because they've built up local knowledge, local contacts and local confidence to allow that to happen. And there's more work to be done in other settings, but we're confident that that great work that our community health partners have been doing on the ground is the pathway to success in those high-risk housing settings.
Jerome's just vaccination uptake has been for people in public housing spaces?
Overall, not what we want it to be. So we've been working with particularly the higher risk public housing tenants. It's not just public housing, it's also supported residential accommodation settings and other arrangements like that. But as I've indicated, we've had at the one end really high levels, over 75%, and at other groups it's bumping along at a lower rate. Having said all of that, those public housing tenants are a part of our wider Victorian community, and we've seen quite an uptick in interest and support over the past couple of weeks because, of course, those people want to keep themselves and their families and their communities safe. What they are looking for and what we're seeking to provide through our coalition of community health and other trusted faith and community leaders as part of those communities is reliable, engaged sources on the ground that those communities have confidence in, that they can take charge of their own public health measures in their own communities, and we're starting to see some good results for that. Would we like to see more? Of course we would. We would like to see every part of our community up at about 75% vaccination rates, if not more. But there's a long way to go.
Jerome's just said fewer than 5 on that number and that outbreak. You said you don't want to identify families. Does that mean it's one family or a number of...
I'm not going to speculate. It's their personal close contacts associated with the West Melbourne outbreak through the school. Testing has been prioritised. As you've heard, overall, very high rates of negative results have come through. There's still more to come through. We've wrapped around through the school, through those same community organisations that I've just been talking about, the support that those families and that those communities are looking for. And we want to make sure that the trauma that those communities went through last year is not repeated. That's why working with trusted, on-the-ground groups, the community health organisations, the schools, the local councils and the faith communities and other trusted sources of information, we want to support these people in a positive, the most positive way. And I'm confident that that's what we're achieving.
Have those towers been deep cleaned since this outbreak? Since this link?
High touch points are cleaned 3 times a day, and we've certainly, particularly in the high risk towers, and we'll work with, again, those same groups, that if anyone has any concerns about the levels of particular towers needing more work, we'll work with them on achieving that. Anything else? Thank you for your time and have a good afternoon.
Thank you.